we've lost 50% of our hair before we realize that our hair is thinning. And then there's a huge emotional toll in that. It's very anxiety provoking.
Our first hypothesis is senescent cell driving hair thinning, hair loss? We could reverse the amount of senescent cells when we treated with this peptide. So we did the two arms of the study, one with OS-01 and one with minoxidil. And we're, again, surprised and happy that we could deliver better results than minoxidil.
That's incredible. That's huge.
It's very clearly that, hormones are impacting, our hair thinning. And there is this component of the senescent cells, so we can counteract this by targeting the senescent cells that are causing inflammation in your hair follicles and accelerating this process even more.
Welcome to New Frontiers in Functional Medicine, where we're exploring the cutting edge of what's possible in health span, lifespan, and the future of personalized care. If you're a clinician who's passionate about staying on top of the latest science in functional medicine, longevity, and clinical innovation, you are in the right place. Each episode, we will deep dive with thought leaders, researchers, and clinicians who are moving the needle, so you can translate emerging science into real impact for your patients. Let's get started. Interested in reclaiming your roots and addressing hair thinning? Visit oneskin.co/Dr. Kara. That's oneskin.co/DRKARA for 15% off your purchase of OneSkin's OS-01 Hair Peptide Scalp Serum. Welcome to New Frontiers in Functional Medicine, where we are interviewing the best minds in functional medicine. And of course, today is no exception. I am here once again with friend and colleague, Dr. Carolina Oliveira. She is a scientist, an entrepreneur, and a leader in longevity innovation. She's the CEO and co-founder of OneSkin. With a PhD in stem cell biology and tissue engineering, she is co-inventor of 5 patents, as well as the co-author of numerous scientific publications in regenerative medicine and aging. Carolina, it is so great to be with you again on New Frontiers. Welcome back.
Oh, thank you, Dr. Kara. Always happy to be here.
I'm a huge fan of OneSkin, as you know, for many, many years now. OneSkin is on my skin, actually, as I talk to you. Over the years, first of all, I love your commitment to the science. I love your team's commitment to your very curious minds. We've had some very fun dialogues about how the OS-01 peptide may be applied elsewhere. Because when you understand it mechanistically, and we'll be sure to link to the other podcasts, blogs, all of our content will link in the show notes for anybody who wants to do a dive back in time with my conversations with OneSkin. You can go do that. And we'll talk about it here as well to an extent. But one of the miracle things about this really cool peptide that your team discovered is that it can be applied in many different ways. And so you are here today to talk about, what you're unveiling, this new application for the OS-01 peptide. So maybe give us a little bit of background on OneSkin and the skin products and the OS-01 peptide, and now where you're applying it and why.
Yes. So OneSkin, it's a science-first company developing products that are designed to target one of the key drivers of aging, which is cellular senescence, or the accumulation of these zombie cells that happens throughout our body. We're more specifically focused on skin, and now we're going to talk about hair. But essentially, what we have been doing over the years is basically creating this platform that we replicated the skin aging in the lab, and then we tested hundreds of peptides to find the peptide that could reduce significantly the amount of these aging cells, the zombie cells. And we found OS-01. After a few years of research, we validated that OS-01 does this in a very specific, targeted way, allows the healthy cells to replicate by reducing the amount of these aging cells that are there just like impairing the healthy cells to grow and to do their job well. We like to compare the senescent cells sometimes with like weeds that are impairing, the plants to grow. And when you remove those weeds, the cells that you have in your skin can thrive. So that's what peptide, the OS-1 does. It basically targets these aging cells that are causing tissue degeneration and causing inflammation. And we first applied it to the skin, which is our primary focus of expertise, and we develop a topical product that delivers this peptide into your skin, both like face, body, and then sunscreens. And more recently, we were interested in learning or exploring how this peptide could also help other conditions, excuse me, they are also associated with the presence of these senescent cells. And from the studies that we found, one of these conditions is hair thinning and hair loss. And none of the products that were in the market were actually exploring a solution that would address senescent cells in hair follicles. And that's what we have been researching for, past like 2.5 years. And even from studies that are already published, it's really interesting to see that when they treat mouse that are, full of senescent cells, and they get rid of those senescent cells, one of the first things that they see is that the mouse fur start to get like fuller and healthier again. So that gave us some insight for us to explore treating OS-1 for, hair thinning and hair loss.
Very interesting. That's exciting. I have, waxed philosophically with you and your team about using OS-1 internally, and maybe one day you'll go in that direction.
You want to go there, yeah. It's one of our, obviously desires, but it's such a complex, development. So
Sure.
For now, we're primarily focused on the topical.
Well, it's fabulous. And you're putting a lot of energy into the science and figuring out whether it works and doing the preclinical as well as the clinical work, and that takes time, it takes investment. And hair loss is a really, really big deal. As we were pondering this podcast, my team and I, we just thought, we were thinking about products in the functional natural market that work. I want to say virtually zero, right? Or they're difficult. I remember there was a product some years ago that I was excited about, but it was hard to apply and it was goopy and it was pretty depressing, and people had to commit to it and in a certain way, and there was a loss of adherence around it. Or I've got a friend who's invested heavily, quite a bit of money in stem cell injections and PRP injections, and to some benefit with PRP, but it's a pretty brutal journey.
Yeah, and it's not something that, it's something that you need to go to a clinic, and obviously your PRPs are as good as your health, your internal health, and your age, right? So if you're still young and you can have a lot of growth factors in your PRPs, that's great. But for some people that are more in an advanced age, they may not have those growth factors as we hope. But I still do it. I think for those who are going through this journey of like hair loss and hair thinning, you gotta try more than one thing, because it's really hard to find just one thing that's gonna solve it all. And I'm a big fan still of the PRP and the stem cells and red light therapy. And now, we have a solution that's drug-free that can be used at home. So I think that complements those, options of treatments that are out there.
2 points that I want to say before you dive into telling us about OS-1 for hair is the statistic you gave me before we hit record, and that is that basically half of us are we've lost 50% of our hair before we realize that our hair is thinning. And I have thick hair, I'm blessed with almost exceptionally thick hair, except that it is thinner. It is, I can tell, and it's anxiety provoking. And so it has to be true, because all of us are on the journey of losing hair as we age. And there's a huge emotional toll in that. It's very anxiety provoking. It feels powerless. And
Yeah. And I think, I mean, obviously we're used to this topic for men, but I think women may be even more affected emotionally because we're in theory not supposed to, get bald or lose our hair. And when you go through that, it's so like challenging because now you're trying to find ways, to
yes,
hide your parts
yes,
and you always needed to, you take a picture and you don't look like how you look, and it's just like
it's hard.
really hard. And so I think I'm really happy to also be supporting more women in this journey,
Yeah.
which a lot of times cannot have access to the other options that are in the market because they can be, again, influence your hormones in so many ways. So I
Yeah.
feel it myself because I have like androgenic, hair loss in my family, and I'm experiencing it, and I'm glad that I have this product now, but I wish I had this when I was like 30 years old because I could have been more proactive about it. And I think that's one thing that we are now realizing that we should, treat our scalp in a similar way that we treat our skin, like for prevention, right? Like we treat our
Yeah.
skin to prevent wrinkles and fine lines. Why we're
Yes.
not treating our scalp to prevent hair
Yes.
thinning? And so, yeah, I think
100%.
it's important to definitely talk about because a lot of people are going through this
And
right
to your point, women, I mean, we're being, I think, hit very hard, but there's an expectation that it isn't going to happen. So there's a level of pressure,
now.
as usual, that's sort of unspoken. You won't go through this. And,
Yeah.
another girlfriend of mine, goes through extensive expense at having weaves done. So it's really kind of heartbreaking the steps that we go through, and it's all on the down low, and there isn't a lot of support. And only Jada Pickett Smith can shave her head. Like a lot of guys will just go to a buzz, they'll just completely switch their look, but that's not going to happen with women. So yeah, it's this we're pretty vulnerable to the ravages of this. And to your point, why aren't we like? Why haven't I thought about my scalp? Until now. All right, so talk to me about the journey of the science that you did behind or what you found as you uncovered the science, and how you're using OS. So what is the product? I haven't had the chance to see it yet. I haven't tried it yet. I'm dying to know. I love your other stuff.
We did send you the problem.
Yes, yes.
So basically, our first hypothesis is senescent cell, you know, driving hair thinning, hair loss. So in order to validate that, what we did, we cultured hair cell follicles in the lab, and we induced senescent cells formation with a stress hormone. One of the main cause of hair loss is when we are going through some kind of stress in our lives. Uh, and we see that we could induce senescent cells with that stress hormone, and we could reverse the amount of senescent cells when we treated with this peptide. So we validated this in vitro. We're also able to validate that the peptide and the solution that we created with other actives could stimulate the hair growth. So another experiment that we did, we got like scalp tissue and we isolated the hair follicles, and we're basically treating the hair follicles to see how much we could stimulate the growth. And we saw that we were able to basically induce that growth in a very significant way. So the next phase was basically to formulate OS-01 with other ingredients that are also designed to support your scalp health in terms of blood circulation, that we also know that's important to improve hair growth. We have some antioxidants like fisetin, which we're very
Oh,
familiar with,
wow.
and there are some, fisetin is also a senolytic in some ways, but it's an
Mhm.
antioxidant, it's an inflammatory, and the studies again with mice and fisetin show a hair growth. And we also have some prebiotics that also help the scalp microbiome, which are also really important to support hair growth, and the scalp microbiome shifts with aging, and the bad bacteria and fungi can also impair the hair growth. And so once that we have formulated this, we did consumer and clinical studies. So we did a study like for 3 to 6 months, and the results were really impressive. We saw after 6 months of applying this product twice a day, 40% increase in hair density and 40% increase in hair thickness. So really, really impressive, and we have a lot of before and afters, but this was quantified with an instrument like called the hair matrix, and this is all done by a third party, CRO, an organization that runs this study completely independent of OneSkin. And we were really happy, surprised to see that we could stimulate this amount of like hair growth, decrease the hair shedding with this treatment. It takes time, right? We know that 6 months is not nothing, but we know that it does require that consistency, because hair growth, it is a little more challenging than treating your skin, for example.
What's the quantity of OS1 compared to, say, the skin topical or the eye serum? Do you have to go? Is it a higher percentage in the hair product?
It's a similar concentration. In the delivery system, that's different because this formula is completely a water base, so it's a serum. So you're basically gonna apply, and you can massage and you can style your hair. It's not gonna leave your scalp greasy or itchy, and so it's a very easy to use and to include in your routine product. But the concentration is similar, but it's able to penetrate even faster because for being a serum, and also because the hair follicle basically already has kind of a channel that the product can go straight into it.
Interesting. Huh. Would you use it on your face? I can't help it out. Like, is anybody doing that just because it might?
I mean, yeah, we have not thought about that.
I'm sorry.
We needed to, no, I love all those questions. We would need to test the penetration, because for the face, the barrier of the skin is different. And we add other ingredients that help deliver the peptide through the barrier.
Yes.
That's why I said for the scalp is easier, because the follicle is already open, and so
Got
it's
it.
easier to penetrate there.
Got it. Yeah, and I like the feel of both of the creams, especially. I'm a huge fan of the eye cream and the tinted sunscreen. I might as well, I'll put it out there. I've used OneSkin for years now, and I've never. It feels great going on. I've never had any kind of negative experience, nor have I gotten feedback. In fact, even my most sensitive patients use OneSkin without an issue. What about the hair serum? Are there any contraindications? Have you had any reported side effects? Did you notice anything in the study that might be untoward?
Yeah, no side effects. The product is designed to be very gentle and soothing, so anyone can use at any age. We make sure that all of our products are safe first, and so for the skincare products, we are validated by the National Eczema Association. So people with sensitive skin, eczema, they can use the product. And for the scalp, it's the same. It's safe for everyone, and as we said, it can be combined with other treatments if you want.
Perfect. So we talked about using this starting earlier. You wish that you had this earlier, and you use it twice a day in active therapy in your clinical research.
Yeah.
And that's the CRO's independent clinical research organization that they hired to conduct the study. Hopefully that you're publishing on it, and anything that you've written up, you are. Okay, so we'll link, if there's any content available, of course we'll link to all of that in the show notes. I'm very excited to hear about it, and just always impressed and grateful for your contribution to science and your commitment, and the financial commitment and time, et cetera, to undertaking this kind of investigation. I think it elevates all of us for this work to be happening here in our space. So twice a day in active treatment. And you talk about starting earlier. I mean, would it be easier? Would you do this active treatment, or might it be added to, say, a leave-in conditioner? Or I mean, you know, is it always going to be a twice a day application for prevention, or might there be a little bit of an easier
Yeah,
routine?
I think for prevention, you can probably start once a day.
Hmm.
I personally use once a day just because it's hard. I know that twice a day can be too much, and to style the hair, so I use at night, and then either in the morning I'll wash my hair. Although some people don't need to wash their hair, but so I think for prevention you can start to once a day, and if you really to actively stimulate more hair growth, I would go twice a day. We also have a micro needling that we
Oh,
suggest for
interesting.
people to use to help again the absorption of and the penetration of the product, and we know that the micro needling will also help, but yeah, I would say at least once a day.
And do you suggest that a local esthetician does microneedling and applies the topical, or do you actually have a device that you're selling along with the
Yeah, we
product?
we actually sell as an add-on to the product, so it's you can do at home. It's pretty easy. You shouldn't like be creating huge pokes into the skin, but just a little bit to help that penetration.
Interesting. Okay. And now for me, where I'm noticing it here. I think was
Yeah.
sort of the first place for women frequently. Can it be local to that area, or should it just be all
Yeah.
over?
Usually, I mean, if it's for prevention, if you can do all over, but if it's targeted, you go to the areas like the hairline, the way that you part your hair, and you microneedle first, and then you apply the serum on top, and you massage, and it should be pretty easy, not greasy. Um, and yeah, we're really excited about all the results. We have like lots of partners that are using and posting their own before and afters, and we love seeing that because it's a challenging condition that we are after. We know everyone is interested in hair loss, and we know
Yes.
there are solutions out there, but none of them are perfect in any
Yes.
way. So
Yes, yes, yes. It's a massive problem, and again, the emotional component of of hair loss is huge. I am thinking of another patient who's been using Rogaine for so many years that there's some pretty significant background hormonal imbalances that have resulted, yeah, for that dependency, and it would be just really powerful to transition him onto another treatment. I will link to some of those stories. I think you probably have them on your website. It would be fun to see some of the before and
yeah.
afters. What about you? Like, what have
Also,
you? Yeah, go ahead.
Also, in our study, our clinical study, we did compare with like minoxidil or Rogaine,
Mm-hmm.
and our product actually outperformed the Rogaine on the density and the thickness. So that's on our website, and we can link it to the.
Unbelievable.
But we did the two arms of the study, one with OS-1 and one with minoxidil, and we're again surprised and happy that we could deliver better results than minoxidil.
That's incredible. That's huge news.
It is,
Better results
yeah.
than minoxidil.
But
That was, yeah. Go
yeah,
ahead.
for those who wanna combine, as I said, like if you are up to it, you can also combine. There's no counterindication of like,
And it's different mechanisms.
yeah, totally different mechanism.
So might you have a stacked effect? Is it possible that combining may be more efficacious than?
It is possible. I think this will vary from person to person, and obviously you wanna observe if there won't be other side effects, as you said, the
Yes.
first patient that was impacting their hormones. So I think everyone should evaluate depending where they are in their lives. For example, I'm trying to conceive right now. I'm not using any minoxidil or any drug-based product. So I use my product. Sometimes I do PRP, and I do the red light hat as well.
Mhm.
These are like safer alternatives for people that are, you know,
Have you been able to analyze your hair using any of the instruments you're using in research to see whether or not you've noticed a difference, or are you just analyzing
Yeah, I'm
visually?
just analyzing myself, like taking before and afters, but I do see a lot of like the baby hairs,
Yeah.
growing. And so that part is good. Like here I had a lot more of there. Yeah, so there.
Good. Good, good, good. I'm excited to start using it in practice and
Yeah.
actually, use it myself on these changes that I'm seeing. Oh, good for you. Well, congratulations
I
on
know, and
on
to be honest, like
yeah.
once I saw the 6 months data, I was like, okay, I needed to use this myself, because also I'm also driven by the data, and
Sure.
it's a reinforcement.
Yes, that's right. And I completely understand.
Yeah,
That's very funny. I mean, you worked a lot on your skin. We've talked about your
yeah,
skin previously as well, and some of the history that you've had with dermatitis. That's fabulous. Okay, so that was my other question regarding other interventions, how it compared.
yeah.
Um,
I think it's important to mention, obviously, minoxidil and Rogaine, the main mechanism of action is that it stimulates the blood flow, right? And so by providing more nutrients, your hair can grow faster. Some people are taking it orally, which again can have other implications.
yeah.
Most people apply it topically. So that's one solution that's out there. And then you have basically the drug based like finasteride, dutasteride that are preventing the conversion of testosterone into DHT, because one of the key drivers of hair loss is when DHT binds the receptors in the hair follicle cells, and that leads to hair shrinking, right? The miniaturization of the hair follicle. And there are these drugs out there that they can prevent this conversion from testosterone into DHT, but also there are many, many side effects for men,
And
potential erectile dysfunction
yes.
and the levels in testosterone. And so
Yes.
I think you need to be careful, but there are these alternatives mostly for men. I would say for women, again, can really mess up with your hormones. But the goal of these other treatments, again, is to prevent the formation of DHT, which we know in the case of androgenic related hair loss, it's one of the key drivers of this.
Yes. What about other mechanisms? I mean, understanding that we're focused on senescent cells gives me an idea that it's likely going to be more efficacious in sort of probably middle adult on, would you say?
Yeah, so the hair, what we call like age-related hair thinning, which
Mm-hmm.
usually affects people around their 50s, that's the condition that's more associated with cellular senescence, at least more driven by cellular senescence. So the androgenic related hair loss is mainly genetic driven, and the cellular senescence can be a contributor. So you can also, use the product to support you there, but it may not solve the problem completely. And then you have the stress-induced hair loss or the hormonal-related hair loss, which affects, a lot of women during postpartum and menopause. And in both of these situations, we know that when estrogen declines, estrogen is a hormone that keeps our hair in the hair growth phase, and when it declines, the hair transition into this shedding phase. That's why we see a lot of the shedding postpartum and through menopause. And progesterone is also a hormone that prevents the conversion of testosterone into DHT. And as progesterone declines, we also see more DHT binding our receptors, and that leads to more hair thinning. So it's very clearly that hormones are impacting our hair thinning, and there is this component of the senescent cells, so we can counteract this by targeting the senescent cells that are causing inflammation in your hair follicles and accelerating this process even more.
So a really a good protocol would be using the OS1 topical, using the OneSkin topical, maybe plus HRT or plus
Yes,
progesterone, and
yes,
yeah,
yes.
that makes sense. I can't say that I've seen a in my patients on HRT, and specifically progesterone. I think that there's a lessening of hair loss. I don't know that we're stimulating regrowth, however.
Yeah, exactly. So you can pair with OS1, so you can stimulate the regrowth, but at least you are slowing down the preventing, the hair thinning, the progress of the hair loss.
Wow, that's okay. That's fabulous. What about you talked about stress-induced hormone imbalances? Um, Thyroid comes to mind as it's another sort of classic hormonally induced cause of hair loss.
Yeah, definitely, any thyroid dysfunction can also impact. And so for these conditions, you obviously want to try to fix these issues as well. And
Hmm.
again, OS1 hair can help you to go back to that growth phase again and accelerate the hair regrowth and maintain the hair in a healthy state. But I think for, all of these conditions that are driven by hormone imbalances or thyroid dysfunction, we still needed to treat, the main issue there.
Yeah, of course. So we do the root cause. So we do our full functional approach, and we get in there and address the senescent cell, the
Yes.
accumulating senescent cell burden. And I would imagine that these drivers of hair loss are probably not helping the aging journey, the accumulation of senescent cells.
Yeah, no, for sure. I think all of these drivers, they're either causing some kind of inflammation, they are compromising the barrier in some way. So if you think in menopause, your skin is getting drier, your barrier is compromised. So in your scalp, this can also happen. And and it's important to maintain again a healthy scalp microbiome. A lot of times we go out in the sun and we don't have a hat and our scalp is being exposed to UV damage and is getting sunburn, and
Yeah.
that's also driving hair loss. So a lot of these conditions obviously they are interconnected.
Very interesting. And we're not giving it sufficient thought.
Mhm.
We're thinking about our faces, we're thinking about
Yep.
our bodies. Right. God, I always liberally put sunscreen on my daughter's hair because she's so thin, but I'm not thinking about
Good.
mine
Yes,
enough, you
good.
know?
Yeah, at least so, wear a hat all the time. And sometimes I also
Yeah.
forget. And then
Yeah.
later at night, I'm like feeling my scalp like,
Yeah.
red and a little sore from the sun. And it's, yeah.
The product design sounds pretty cool that you've got phycetin. I'm a huge, huge fan of polyphenols and their pleiotropic benefit to all the hallmarks of aging. So that's neat that you have that in there. And then you've got a prebiotic. What are some of the microbiome changes? I mean, I can think about how my hair texture and has changed over the years. It's drier now than it used to be. I definitely had more natural oils
Mhm.
when I was younger. Um, but that's really interesting to me that you're thinking about the hair microbiome. Talk to me about that.
Yeah, I think, as you know, our microbiome is important in our gut, in our skin, and it's also important in our scalp. And so,
Yeah.
as our microbiome, changes with the aging process and loses that, homeostasis, we start to have more of the bad bacteria that will promote more hair loss and less of the good bacteria that should maintain the hair in that growth phase. And by feeding the good bacteria with the prebiotics, we can basically recover that healthy microbiome. So we did see a shift in our clinical studies. We also collected the scalp microbiome and
Oh,
analyzed it, yeah, at the baseline in 6 months, and we did see a shift in the amount of good bacteria and a decrease on the bad bacteria that's associated with hair loss. We also saw a decrease in some fungi that are associated with dandruff, which again, all of these conditions are related to, inflamed scalp. Your scalp is like flaky. And so recovering that microbiome can have these other benefits. Uh, because again, we a lot of times we're not using the right hair products, right? A lot of like preservatives or like some toxic ingredients, and we
Yeah.
are dyeing our hair and we are
Yeah.
doing so many things. So we gotta be able to, treat and trying to recover that scalp microbiome that's like being affected in so many ways.
Fabulous. I love it. I love that you're bringing attention to hair loss in this very science forward systems thinking model. It's super cool. Publications that are in the works, like what are you, so from the data that you've gathered, your preclinical and your clinical, what are you working on, and has anything been published so far?
Yeah, so we just concluded this study in June. So we are
Hmm.
working on the publication right now. Hopefully, by the end of the year, should be available. We already have a summary of our clinical data and our in vitro data in our website, either on our pages, the product page on the blogs. But we are working on that publication. But yeah, this year we already published like the eye clinical study. We published the body clinical study, and and we have more exciting things in the works that will be publishing soon.
Woo! That's so fun. That's great. Anything you can share with us, or is it all like pending?
I mean, we are continue to dive deeper in the mechanism of action of the peptide. So one study that we did was really interesting. Well, first we found that the peptide reduces senescent cells like in only in the skin cells. And then we tested now that the peptide reduced senescent cells in all types of skin cells. So we evaluated like cells from the dermal layer, the epidermal layer, the immune system. So we are modulating cellular senescence as a whole in the skin, and then we can see how the skin is shifting to a younger, more functional, more resilient skin. And this is with very, advanced techniques of like single cell sequencing. So really understand what each cell is like expressing in some way. Um, and then we are also, doing other studies to improve the penetration of the peptide into the skin. So there's a lot more that's going on that, will translate into even more effective products down the line. So we, yeah, we love, continue to push the science forward and with the goal, obviously, to bring better solutions for our community, for our customers.
Very exciting. Would you deliver, or would you apply OneSkin after microneedling? I mean, many of us are doing microneedling.
Yeah, I would say not immediately because the one skin, you mean for the skin, not for the
Skin, for the
face.
skin. Yeah, that's
Yeah.
right.
Because the product is an emulsion, and usually after
Yeah.
microneedling, you want a water-based product
Yes.
or a hyaluronic acid base. But the next day, yes, you can apply, no problem. We will really help your skin to, heal faster, regenerate, reduce the redness. The product is really soothing and calming and anti-inflammatory. So that, I did a microneedling recently, and the next day I applied one skin, and I felt like it helped so much. And I even applied the one product that we were developing that was also very good.
Nice.
So that one will come up soon. I think the other area, I don't know if you're aware, but that we've been studying a lot is our lips, because it's kind of a neglected area that
Yeah.
we mostly, ignore. And so we develop a lip SPF that's mineral based, and the data shows that can increase elastin as well, so it can help like with the health and the function, of your lips. And then there's another one coming up that's also focused on repairing, the loss of volume that we had, over time.
Wow.
Inducing collagen, elastin, and hyaluronic acid. So that one will come up in October, and the results are really incredible. So I'm excited
Wow.
about that. Yeah.
Wow. Wow. Well, hopefully we'll circle back and we'll
Yeah.
dialogue about what that is.
Yeah.
I really want to know. I've felt very dubious about those product claims where that any kind of
I know exactly, and we, I mean, everything that we say, we have the data to back, and now we are validating with consumer studies, so which is really exciting, so beautiful to connect the science in the lab with like
yes.
the outcomes that the people experience when they're using the products.
That's fabulous. I'll look forward to looking at some of the before and afters, and of course, reading
Yes,
the paper when it comes out. All
yes,
very, very exciting.
yeah,
One of the fun things we were talking about, I'm a science geek, obviously, which is why I fell in love with your product in the first place. They were, by the way, these are the science that her Carolina and her team are the scientists who developed the first epigenetic skin clock. I think the only I don't know if there's any others out there to date, and that sort of started our conversation. I was very excited about this OS-1 peptide who could move back the hands of the epigenetic biological age. And so you and I were just talking off recording. I stumbled upon, thinking about Yamanaka factors, these four transcription factors that, when applied to a somatic cell, can reverse it all the way back to pluripotent stem cell status, Yamanaka factors. And there's all sorts of research happening in, cell rejuvenation studies. Looking at animal models and all sorts of it's a hot area of research right now, reversing or cellular rejuvenation here. And it turns out I stumbled upon a paper seeing that some of these transcription factors, these Yamanaka factors, some, not the full quartet, are right there involved in the very unique growth process of hair, in keeping those stem cells. We have to have those stem cells present to allow
yeah,
for hair growth. And so I threw that out to you, and Carolina has agreed to look and see. They have the technology to be able to see whether or not they're expressing these. It's the SOX2 protein in the Yamanaka factor quartet, and that would be part of why we're seeing the regrowth. And so
yeah.
I think you probably are.
Yeah, and I mean, it makes sense. And an interesting thing that I did recently, there is a company that can starve your stem cells by collecting
Yes.
them from the hair follicle. Have you seen?
Oh, is
Yeah,
that where they're collecting it? I didn't realize
yeah.
that.
So I
I
did
see.
that. I was in a
Cool.
conference. I met the founder. They basically collect like, I don't know, tens of hair follicles, and they will isolate and grow your stem cells from your hair follicle. They will freeze down, and they even produce like what we call the secretome, what the senescent cells, the stem cells are secreting, and then they can ship you for you to apply in your face, on your hair. But it's a really interesting way for you to keep your stem cells without being invasive, right? Because the other
Yeah.
options are bone marrow or like
Yeah.
exposed tissue,
Yeah.
and even like your dental pulp. But obviously we need it to be, the
Intense.
kids, and the kids, like when you, I usually tell my friends, like when they are, changing teeth, like keep the dental pulp, and send it to collect the stem cells for the dental pulp, because from the studies, it's one of the key cells that still have a lot of the Yamanaka factors transcription genes active as an adult, like adult,
Wow.
I mean, a kid, but it's still a grown, like not a baby. So it's an interesting source. And but yeah, for adults, I think the hair follicle is an interesting one. And now I'm excited to see if OS-1 is, turning that SOX2 on, or if, yeah, it's already on and we can elevate the levels. I'll definitely investigate that.
Yeah, I'm super curious about that. So basically, when my daughter loses another tooth, I need to hang on to it and bank it.
So you needed to find a company that you can
Hmm.
ship to, and they
There's one here in Mexico City,
okay,
actually.
yeah.
Yeah.
So you connect with them, you ship to them. They should isolate the stem cells and freeze them down. because then your daughter can use later in life for many things. And the earlier that you freeze them down, the better, because
Yes,
they
they're
are,
young.
yeah, exactly. They have more like potency of dividing and becoming any kind of cell.
That's so cool. A random side topic. That's really cool. I want to do the same with my hair follicle. I'd rather do that than a fat biopsy or a bone marrow biopsy for sure.
Yeah, I can link the name of the company that does this.
Thanks. Well, Carolina, it was fabulous to be with you. I'm always excited to hear of the many, 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 many things that you are up to over there at OneSkin. And it's an honor for me to be able to support kind of elevating your brand. And of course, you support women in science. I think your team is entirely comprised of women PhDs. So,
Yes.
yeah, in many ways, I just feel very much in alignment with the spirit of what you're doing.
Yeah, no, likewise, Dr. Kara. I'm a big fan of your work, and it's always a pleasure to, be able to come here, share these updates and all that we're doing. And thanks for supporting us. And
100%. Yeah. And we'll pay attention in our patient outcome and, people on our
yes,
platform who are using the product. Folks, stay in touch with us. We want your feedback.
yeah, we definitely want to hear all of you.
Yes. Thanks so much.
Thanks, Dr. Kara.
Interested in reclaiming your roots and addressing hair thinning? Visit oneskin.co/Dr. Kara. That's oneskin.co/DRKARA for 15% off your purchase of OneSkin's OS-01 hair peptide scalp serum. Disclaimer. This podcast is for informational purposes only. If you have a specific medical concern or if you have any questions, please speak with your healthcare provider.